Hi there, I'm Kristen Aguirre with Public Media Network, and today we are sitting down with CEO of YWCA Kalamazoo, Susan Rosas. And Susan, you guys are getting ready to celebrate 140th anniversary. It's like centennial. What? You guys have a big celebration coming up. But for people to get like the full picture, what exactly does YWCA Kalamazoo do in our community?
Well, our services have morphed over the years. We've been around for a long time, and so we
Hmm.
adapt to meet the needs here in Kalamazoo. Right now, our primary areas of focus are victim services. So, for the last 75 years, we've been supporting survivors of various forms of violence, domestic violence, intimate partner violence, sexual
Hmm.
assault, stalking, human trafficking. So, that's one area of service. We also provide infant and maternal child health services.
Hmm.
So, we operate Cradle Kalamazoo, which is a collective impact model to help to reduce infant mortality and
Hmm.
specifically to reduce racial disparities in
Hmm.
infant mortality. We also have home visitation programs to achieve the same thing.
Yeah.
And then lastly, we have our early childhood education programming. And so this is programming that's designed to provide high quality care for kids 0 to 5 using evidence-based practices, but making sure that we adapt to the needs of families who might not otherwise be able to access care.
Sure. So you guys are doing all the things in the
All
community. Cradle is relatively new, right? Have you seen it flourish since you launched it?
So Cradle launched almost exactly 10 years ago. So
Oh,
this is
okay.
we've been doing early childhood education for 40 years and we've been doing our victim services work for 75 years, and each of them has just developed and morphed as we've learned more.
Hmm.
So as it relates to infant mortality and with Cradle Kalamazoo, part of the model itself is learning. So we collect a lot of data. We better understand what is leading to infant mortality here
Yeah.
in Kalamazoo. And then from that data, we're able to derive what intervention makes the most sense to try to make
Sure.
sure babies celebrate their first birthday.
Yeah. My baby just celebrated her first birthday.
Congratulations.
Thank you. We talked about years. Kalamazoo 1885 is very different from Kalamazoo 2025.
Sure.
How have you guys adapted over the years to make sure that you're really supporting the community?
Hmm. Well, I think a lot of how we've had to adapt our services is based on what we've learned, sometimes based on mistakes made, or often based on what we've seen develop as broader anti-violence movements or
Hmm.
broader understanding of where inequities rest. As an organization, we have been focused on addressing inequities from the onset, where we were always a feminist organization.
Hmm.
For many, many years, we've been an anti racist feminist organization, and that has required us to stay attuned to how are different communities inequitably impacted by
Yeah.
shifts in the community. So,
Hmm.
because of that, our services change over time because as we learn more, we understand what works better and what doesn't work at all, and we adjust ourselves to meet the need.
Yeah, one way you guys have also been getting your message out there is your latest campaign, Woke Since 1885. Can you tell me a little bit about the origin of this campaign and the message you want to get out there?
Sure. So our founding year is 1885, and when we were launched specifically to support women who might not otherwise access the same services that other communities may be able to access,
Hmm.
specifically men. And over the years, we've been able to adapt and change as we recognize that women of various identities often have inability to access services. And then more broadly, we look at racial disparities. One of the challenges with this is that we are always pivoting ourselves to make sure we are addressing the needs of those who are experiencing the greatest systemic oppression.
Hmm.
And the systems are designed to not like that. And so from the
Hmm.
very beginning, we have been disparaged with various insults. So with the feminist movements, we were called shrill or
Hmm.
hysterical or
Hmm.
any number of pejorative words. And today, the word that's used to describe us is woke because we're paying attention to these racial inequities.
Hmm.
So we're in this campaign, we're reclaiming that word. We're saying it's not a bad thing to be.
Hmm.
You can call us woke now. We were shrill before.
Yeah.
We're radical at some point.
Yeah.
And all it means is that we're progressive and we're fighting on the right side of history.
And so you're taking ownership of that insult, right?
That's right.
I want to dive a little bit on a personal note. Now, if you're a local here in Kalamazoo, you've really seen you're at the forefront of holding these press conferences or letting the community know about the cuts that this current administration are issuing to our community and how it's kind of impacting all these local nonprofits. What made you want to step up and kind of be the leader of this?
Mm. I mean, we were all suffering all at the same time.
Mhm.
With the funding freeze that got a whole lot of press in a few days after the inauguration of the new administration,
Mhm.
all nonprofits that were receiving federal funds were impacted. And when we first at YWCA saw the impact, I started calling around to some of the other executives here to better understand if we were unique or if this was wider spread and more people were experiencing hardship. And it became just very evident that everybody was struggling. And the easiest way to talk about these things when there are so many people suffering is to bring everybody together to have the conversation. So it
Mhm.
was really an organic process that developed and
Mhm.
people wanting to convene. It I mean, I'd like to say that there was some grand plan, that
Mhm.
we saw years in advance that we were gonna put this thing together, and
Yeah.
really it derived from need and
Mhm.
from mutual support and mutual interest, and
Sure.
everybody was really willing and interested in participating, and so we convened, and it just continued from
Yeah.
there.
But what made you wanna step up and put your face out there? Because I'm sure it's not easy.
Mm. We are willing to take the risk. Some of
Mhm.
these conversations are hot button topics right now.
Sure.
We're seeing targeting from from the federal administration on conversations about equity specifically. And YWC Kalamazoo is always going to talk about equity, and we're not going to mince words. We
Mhm.
know how important it is, and we're willing to take the risk. And that was part of why, when we first formulated this coalition, YWCA was willing to put our name on the press conferences or on the news releases that
Sure.
we were issuing as a
Mhm.
coalition because we recognized there's some risk, and that was risk we were
Mhm.
willing to take.
Now, you are also pretty risque on social media. I see you just post kind of your thoughts directly, and there's a lot of support, but there's also negative feedback. How do you kinda deal with that? Does it impact you?
I think everyone is impacted by negativity.
Sure.
That's the empathy in us, that's the human in us. And also, we're not in this for popularity, right?
Mhm.
The work that we're doing is for outcomes.
Mhm.
It's for making sure people have access to the support they need.
Mhm.
And we can't do that by dancing around the thing. We have to say the thing.
Yeah.
And I it's something that I've always uh felt passionately about. YWCA Kalamazoo more broadly feels passionately about it,
Mhm.
and so we'll talk about it.
Mhm.
And I think if we see more people that are willing to say what is impacting our communities
Mhm.
and to be able to address it in a really pointed way, the more people talk about it, the more likely it is that we'll actually derive solutions that resolve some of the issues. There is no band-aid
Mhm.
to correct some of the inequities that we see here in this community. It has to require structural shift, and we have to name it to shift it.
Sure. How did you get into this work?
That's a long story.
We've got the time.
So it's all inspired by my family. My parents have their own origin stories that I found really inspirational growing up.
Mhm.
I come from a long line of really inspirational women who
Yes.
faced
Mhm.
extraordinary adversity, and I never got to know my dad's mother, but
Mhm.
just an incredibly impressive woman from what I've heard, and she raised my dad as a single mom against all odds.
Mhm.
They lived in the basement of a hotel while she cleaned the hotel in order to make
Wow.
ends meet,
Mhm.
and he still they grew up, or he spent a lot of his time in Detroit, some of his time in Mexico City,
Mhm.
and eventually, he was able to start his own business and create a future for himself that his mother wanted him to have, wished that she could have had. And similar on my mom's side,
American dream,
right?
right? Yeah.
It sure is. And on my mom's side, similarly, they came here as refugees and they had lost everything.
Mhm.
They started from scratch. My grandfather was carving furniture to try to make ends meet. My
Yeah.
grandmother, um, i- y- she was so unassuming, and she would come over to the house on Sundays and bring a box of peaches, and you would never know that she is the reason why they survived the
Wow.
violence that they'd been exposed to.
Mhm.
You would never know it. And um, having those kinds of origins, I think, caused the family to always talk about social justice anyway. My
Mhm.
siblings are adoptees, so I was really interested in child welfare.
Yeah.
And so it was natural. We all went into some sort of social welfare
Mhm.
in some capacity
Mhm.
as kids. And I started in the child welfare system, and that exposed me to so much as it relates to inequity and as it relates to sexual violence. I experienced sexual violence myself, which
Sorry.
helped to target some of my interest.
Yeah.
Worked overseas for a while,
Oh.
and it was almost like every new role I took, I learned more and started to gain some understanding of how I could be impactful. Because at first it's so overwhelming, and you think,
Sure.
I don't even know how I can be meaningful in this
Yeah.
work. And eventually you start to figure out this is where I fit and
Mhm.
run with it.
Yeah. How do you avoid burnout? Because like you said, these are really intense issues that you and your team are tackling, and I'm sure they could be heavy, right?
Mm.
Are you able to kinda come in every day with this energy, like, "We gotta make a change"?
Hmm. Um,
Because I know you didn't eat breakfast today.
I did I did not eat
Yeah.
breakfast today. That's a really hard question that I don't know that I'll ever come up with the solution to it.
Mhm.
I haven't burned out, and I think some of the reasons for that are my kids really, and I may have been close to burnout when I first had children,
Mhm.
and they offered me a new perspective on why I'm doing what I'm doing.
Yes.
Uh,
Mhm.
it was always so critically important to me. I mean, I've always been a really intense person,
Yeah.
but the introduction of kids into my life also led me to think of this bigger picture on leaving a
Mhm.
legacy
Yeah.
and leaving them with a world that's better than the world that I saw and that the world that my parents saw, etcetera.
Mhm.
And
It's
it
beautiful.
kind of brought it full circle for me.
Mhm. Were you prepared for the working mom life? Because I was not. I read every book, read every blog article, and then when it comes to it, I'm like, "I cannot do this." You are not prepared for that working mom life, and then you add social justice on top of it. I'm not sure how you are doing it.
If anybody tells you they're prepared for it, they're lying to you. It's
100%.
so intense. And it is such a human experience.
Mhm.
Every woman in the workforce is experiencing it,
Yeah.
and we try to hide it, and we try to pretend like everything's normal and that our
Yeah.
lives haven't categorically shifted.
But that you're a new person after
Yeah.
you become a mom, right? I don't even know that girl before Mabel. It's
Sure.
just she's a totally different woman.
Yeah, it's hard.
Okay, let's get back to the 140th celebration. So the Michigan State budget recently was passed a few weeks ago, and you've been outspoken about its failure to support victim services. How has the YWCA's program been directly impacted?
We are a major provider of victim services in the state of Michigan, and we are the only provider here in Kalamazoo
Mhm.
County. The reason why that's relevant is that every victim service agency across the country is predominantly funded through government money. That's been the model for decades here in the United States. And much of that money comes from a pot of money called the Victims of Crime Act, or VOCA
Mhm.
funding. This funding has been historically decreasing year after year as it's issued from the federal government to states. And the state of Michigan years ago had stepped up to try to fill that gap. The
Mhm.
problem is that the money has continued to decrease from the federal government, and the state has not increased their stopgap funding. With the new slice in funds that we saw coming from the federal government, we saw it coming. And so we were lobbying for months and months and months with partnership with the coalition to try to
Mhm.
prevent this failed funding from occurring,
Yeah.
and it just didn't work. And so the state did not step up to fill the gap, which means statewide, all victim service agencies are going to see an average of 20% decreases in their victim services programming. In addition to that, at YWCA, we are a direct federal grantee, or have been for a very long time.
Mhm.
And we've all seen federal funding volatility in 2025. For example, a third of anti trafficking grants have been discontinued
Mhm.
across the country, including YWCA's anti trafficking grants. We're also seeing the federal government decrease all of their Department of Justice grants by 5% in order to fund some of their other priorities, like the
Mhm.
immigration efforts that they're
Sure.
implementing.
Mhm.
And that is hitting victim service agencies like YWCA directly. So we're seeing that 20% decrease. And for an organization of our size
Mhm.
that serves as many people as we do regionally, it's a profound impact for us. It's across
Mhm.
the board. It's our legal services, therapeutic services,
Mhm.
emergency shelter, advocacy, sexual assault programming,
Yeah.
anti-trafficking programming in a profound way. So it's across the board for us.
What does it mean for the women that you serve?
Hmm. Uh, the degree of lethality that we're seeing in violence has increased in the last decade or so with the introduction of firearms into violence.
Mhm.
So when we see decreases in services, we see decreases in access to protective care, which means we will see increases in homicide. That's our biggest worry, that with the cuts in funding as it relates to victim services, that we will see people needlessly lose their lives that
Mhm.
could have been prevented
Right.
had we seen a different intervention from the state. And similarly, we've also seen decreases in appropriations as it relates to infant mental health or infant survival.
Okay.
And so for our maternal child health work, we're expecting to see increases in infant mortality
Mhm.
because of that reduction in funding. So we're not talking about side projects or would be nice to have types of services in the community.
Sure.
We're talking about life and
Mhm.
death, and those are the services that have been cut from the state budget.
How long, when you see these spikes, does it take them to the come down? Do they ever come down? Like, I'm thinking of COVID when a lot of, we saw domestic abuse numbers skyrocket. Did that ever come down, or do they level off, if that makes sense?
Well, so we aren't seeing right now overall increases in violence in numbers. We
Okay.
are seeing increases in lethality of the violence
Mhm.
that's occurring.
Okay, yeah.
What we're also seeing change is decreased help-seeking behavior from people of various immigration status,
Mm.
which means people are afraid to reach out for help right now
Mhm.
if they are born in a different country.
Okay.
And that is a direct result of some of the changes that we've seen from federal policy and the ways that we're talking about immigrant communities.
Mhm.
And whenever we see entire populations withdraw from help, we
Mhm.
see increases in violence. At
Mhm.
the same time as we're seeing decreases in federal responses to anti-trafficking work in particular, we're going to see increases in exploitation because here we have an isolated community that is increasingly vulnerable and fewer services
Mhm.
available that will meet the need.
Is there any way possible to turn these numbers around? What would have to happen?
I That's a complicated question, I think,
Mhm.
with a complicated answer.
Sure.
Surely we have to fund the services,
Right, right,
or
right. Yes.
but we also have to change the services to meet the
Mhm.
evolving need. We have to change the rhetoric first and foremost.
Mhm.
And sometimes that means that we craft our own messaging here
Mhm.
in Kalamazoo to create the safety that we expect here in a community. And that requires all of us. YWCA Kalamazoo, obviously we're going to say the thing. That's where we're not going to mince words, we're going
Mhm.
to say it. But when we have community members who hear it from the city and from the county and from partner organizations
Mhm.
and from everybody within the community, that in itself has an impact on whether people look for help
Mhm.
or whether people understand that the harm that's being caused to them is unjust. And so I
Mhm.
think um, the intervention that's necessary is not just service oriented, it's also community oriented.
Mhm.
How are we going to protect one another
Right.
and acknowledge that we have an obligation to protect one another?
Right. So this isn't a YWCA Kalamazoo problem. This is a Kalamazoo, West Michigan issue that we need to come together on.
Sure.
Okay. And speaking of community, we have your big 140th anniversary gala coming up next month. How can the community come out and show support for the YWCA?
Come to the gala. This is a really hard time for YWC Kalamazoo.
Mhm.
We've seen dramatic funding cuts just in the last few weeks,
Mhm.
and we cannot allow for adversity to impact our ability to celebrate and to find joy and to bring people together. We are born from adversity, so many of us.
Mhm.
This organization is born from adversity, and we must continue to celebrate even when we're experiencing hardship. I think if people can come and join us in that joy and can celebrate with us at
Mhm.
this gala, it's not only a message of support for the people that we're serving, for the broader community, it's also a fundraiser. And that's something that we
Mhm.
need so urgently right now as an organization.
Great. So if we can't attend the gala, what can we do?
We are right now mobilizing the community to help us to backfill some of these
Mhm.
budget shortfalls that we're seeing from the state. If folks were to go to our website at ywcakalamazoo.org/beradical, That is our new campaign to help us backfill these expenses that people need to survive. We're not talking about frills or extra projects. We're
Mhm.
talking about food, clothing, and shelter for families fleeing violence and for babies at risk for infant mortality. Just the basics. And if we can get the community to step up and become recurring donors to these grants or to these funds, it allows for us to depend on that and to make commitments with survivors to say, we'll help you with rent in the long term
Mhm.
as you start a new life with your kids. We can commit to that. But without recurring donations, it's really hard for us to make that
Sure.
commitment. So that's the new campaign, become a recurring donor to YWCA Kalamazoo.
Who's coming up with these taglines? They're really good. Your team knows what's up. Is there any last messages you wanna get out to the community before we wrap up?
Kalamazoo has to decide what it stands for. For many, many years, Kalamazoo has been at the forefront of a whole lot of really important social justice efforts.
Mhm.
This time is no different, and now is the time for us to act. If we wait 6 months, if we wait a year, if we wait to see what happens, it's too late, so we have to
Mhm.
act now.
Right, awesome. Thank you so much, Susan Rosas from YWCA Kalamazoo. Thanks for joining us today.
Thank you.